title?
My name is Waltina Cummings, and I'm a volunteer today with the Creole Descendants Association, working with Medicine and the Idea Foundation. And I believe there are other partners as well involved in this project.
Would you spell your first and last name for me, please?
My name is Waltona, Waltina Cummings, Cummings.
Waltina, tell me what's important for Sierra Leone to be involved in this, about what you guys done here?
Well, I'm sure most of you have heard that there's a Ebola virus epidemic in the west coast of Africa that involves 3 countries, Sierra Leone being one of them, but in addition Liberia and Guinea on the very rural area on that west coast of Africa. And I'm a Sierra Leonean, born and raised in Sierra Leone, even though I've been living in the United States for about 28 years. And this project is very important to me because we want to help our people back home provide much needed supplies, medical supplies that they need. And this is what Medicine is doing today, or has done, has put together several pounds of medical supplies so that we can send back to these areas in Sierra Leone where it is much needed, to help the healthcare professionals and those who are working on the front lines so that they can get what they need to work with the patients and help the patients that have the Ebola virus.
So in Sierra Leone, have you been there?
Yes, I was born and raised in Sierra Leone.
But when was the last time that you were there?
I was in Sierra Leone in June. I'm a healthcare professional as well, working in Dallas. So what I do also, I do medical missions, and I'm very familiar with the healthcare situation in Sierra Leone.
Tell us a little bit about the situation in Sierra Leone.
Well, the health infrastructure in Sierra Leone is not very solid. It is a very weak infrastructure, and this infrastructure has been like this since the war. You know, the war ended in 2000. It's been 14 years. We haven't really had an effective healthcare system. And so with the Ebola virus infection that is we have the epidemic right now, it's very hard for that healthcare system to deal with the problem. So what has happened, we have had people, not just here in the United States, but also in other areas, in other parts of the world, that have been helping to send supplies and healthcare personnel to help so we can get rid of this dreaded disease.
And all these supplies, I mean, they're going to be great, right? They're going to be a lot of help for the Sierra Leone, right?
That's right. That's what we're hoping, that these supplies to use where it's needed most in all over the country, but especially in the centers, that the isolation centers where these patients are being treated, but also not also in treatment, but also in prevention of the disease. Because one of the things that the organization I'm part of has partnered with people on the ground, is education and sensitization of the Ebola virus and how we can prevent it from spreading. Because with healthcare, it's not just